Hello, my dear future nursing officers. Welcome you all to the Master Nursing classes. So, in this today's very important session, we are going to discuss the most important and very high yield concept for our upcoming Norcet exam. In the last three very important video session, we have discussed the very important concept for our upcoming Norcet exam, that including the all the teratogenic drugs and its specific teratogenic effect, and how to identify that one with image based questions I have discussed. Along with that, all the congenital anomalies in the torch infections, like congenital rubella syndrome, congenital toxoplasmosis, congenital syphilis, congenital rubella. Okay, so many things we have discussed in the first session, along with the obstructed labor and along with the Naglus pelvis, Robert pelvis. Many more questions in the first day one session we have completed. So in the day two session, we have completed the most important concept for our upcoming Norcet exam, that is the gestational diabetes mellitus, overt diabetes mellitus, insulin in pregnancy, adjustment of the dose in the insulin in the pregnancy. Okay, so along with that, the many more questions on the gestational diabetes mellitus and overt diabetes mellitus. Everything we have discussed in the second session. In the third session, I have discussed related to the pregnancy-induced hypertension. Along with that, the very important pre-eclampsia, eclampsia, diagnostic criteria, how to diagnose that one, impending sign of the eclampsia. Okay, so along with that, the sign of the end organ damage and how to manage the hypertensive crisis in the pregnancy. Okay, role of the labetalol and the magnesium sulfate, how to give the magnesium sulfate, and what are the two very important regimens in the magnesium sulfate. So that is the gypsum regimen asked in the last Norcet. Along with that, the Pritchard regimen also we have discussed. Okay, so and how to monitor. Okay, so what are the very important thing we need to monitor before giving the magnesium sulfate? Everything I have discussed in the last session. Okay, so in the today's session, we are going to discuss the very important and two hot topics, hot and very high topic for our upcoming exam. So that is the medical termination of the pregnancy and the abortion. So when you will revise the last previous year 3 questions papers or the 4 question paper, there is definitely one question which is coming from the type of the abortion and the mode of the abortion based on the period of the gestation, which is the best one they will ask. And in the last Norcet, they have asked related to the manual manual aspiration. Okay, so vacuum aspiration. So in that one question was there, what is the actual normal pressure we need to maintain during the manual vacuum aspiration. Okay, so that the 660 mm of Hg was the answer. Okay, so before that, the Karman cannula image based questions were asked, and before that, the Hagar dilatory MCQ was asked. So many questions which are repeatedly striking from the abortion and the medical termination of the pregnancy. It's my prime responsibility to cover those very important and high topic for our Norcet exam, and here we will discuss in detail, in perfect, and whatever the tricks, tips I am telling, so please make note down, and wherever I am telling it is the important and very important, pay a special attention on that one, note it that one, at least take a screenshot and at least practice at least 2 to 3 times, so that will definitely help to every one of you, right? So very good evening to every one of you. Welcome once again every one of you to the Master Nursing classes. And if any one of you are new to the channel, so please subscribe to the channel and hit the like button, so it will help us to grow the community. And if possible, please place our video in your WhatsApp status and share to your WhatsApp groups available in your WhatsApp chats, right? So we will start the today's session. Very good evening, beta. Welcome once again everyone to the Master Nursing classes. If everything is clear, we will start the session. I hope many of you have joined to the session, right? So who all are live, so fatapat hit the like button. Okay, we will start the session with this a very powerful motivational line. Students, if you come out and across this particular aspirant journey very smoothly, very perfectly, with the success rate very high, so you have to follow the very important 3 things. One is you have to learn from the yesterday. So whatever are the mistakes you have done in the yesterday, like in the test series. Okay, consider you have attempting a one test series. Okay, in the first section A, so total 20 questions are there. Out of 20 questions, unnecessarily you have attempted out all 20 questions, and where the 5 to 6 question went wrong and you have landed in the negative marks. So that is the thing you have learned in the today's test, right? And in the next day when attempting the test, you have to go with the calculated risk. Okay, in the each and every session, how many questions need to attempt, and on average questions, how many are getting correct, and what are the my total negative marks, and how to control that one, how to work on that one. You have to think, you have to search, you have to apply. Then that is the thing you are learning from the yesterday and implementing the today and improving for the tomorrow. Okay, so and always live in the today. Don't overthink about the future. What happens if I get fail in the Norcet 8? If I get fail in the Norcet 9? So what happens if like I have get lagged by the again 1 marks? Students, nothing will happen that. Always your focus should be big and you have to work hard on the today. Okay, so always aim for the all India rank number 1. Yes, that spot is made for you people because you are working. Don't just say if one seat I am getting means like it's enough. No, it's not like that. It is not a part of the selection process. If you want to become a part of the mains top rank holder, just you have to say I am the all India rank number 1 and I am made for that one and I am working for that. You have to say to yourself, so then only the rank and result will be possible for you all, right? So and hope for the future. Yes, every tomorrow is very best and every today is very best. So work extra on the today and hope best result for the tomorrow, right? So this is the very important 3 lines you have to follow as an aspirant, right? So hope this motivational line and the discipliner line helped you to improve your performance. Okay, so just I'm throwing the very important questions and scenario in front of you all. So try to give the best answer to the every questions what I'm showing to you all. Okay, so here's the first question is there in front of you all. So please do read the question carefully. Yes, which of the following best defines the abortion? The question is very simple and I'm waiting for your response in the comment box. Okay, so which of the following best defines the abortion? So what is the definition of the abortion is the simple question here. Okay, so option A comes here as the delivery of the dead fetus after the 28th week of the gestation. Beta, if you are delivering the dead fetus, that is after the 28th week of the gestation means, so now the child or the fetus have crossed the period of the viability. Whenever the fetus it crosses the period of the viability and it will get dead and deliver. So if fetus is dead and deliver after the period of the viability, we call that one as the intrauterine fetal death. Okay, so very important thing, keep in your mind. Okay, so then comes to the option D, that is the termination of the pregnancy due to the maternal request. Beta, if mother is coming to a gynecologist or obstetrician and she is requesting, so she don't want to continue the pregnancy because that pregnancy may happen due to the contraceptive failure, that pregnancy may happen due to the rape, that pregnancy may happen due to the incest, or that pregnancy may like life threatening to her, and she coming to the OPD and she is requesting to terminate that pregnancy. So this particular scenario we call this one as the medical termination of the pregnancy. This is the MTP, that is the medical termination of the pregnancy. It's not abortion. Okay, so then comes to the option C, expulsion of the viable fetus regardless of the gestational age. Okay, so regardless of the gestational age, we are expulsing the viable fetus means, so that is also not abortion. So I am eliminating the option C also. Then comes to the option B, and many of you have given the correct answer. So that's the expulsion of the fetus and placenta before the period of the viability or with fetal weight less than 500 gram. Okay, so this is the correct answer. Okay, so correct answer for this option particular first question goes to the option B. Yes, if the fetus is coming out of the uterus before the period of the viability, or which coming out of the uterus before gaining the 500 gram of the weight, so we call that one as in the abortion. Hope the question and the definition is clear to every one of you. Yes, if the fetus is coming out of the uterus before the period of the viability is the abortion, and after the period of the viability is the intrauterine fetal death, and mother herself she is coming to the OPD and she is requesting to terminate the pregnancy because of the various reasons, that is called as the medical termination of the pregnancy. Hope it is clear to every one of you, and yes, many of you have given the correct answer. And here is the very important question is in front of you all. Okay, so the question is very simple here. A 28-year-old woman with 10 week of the pregnancy, she presents with a mild painless vaginal bleeding. Okay, so what happened here? So here is the 28-year-old woman is there and she is having the 10 week of the pregnancy. Okay, so now she is presenting with a mild painless vaginal bleeding for the 2 days. Okay, on examination the cervical os is closed and ultrasound shows the live intrauterine fetus. Okay, so what is the most likely type of the abortion is this? Yes, so what is the most likely type of the abortion is this? Can anyone want to answer for the question? Yes, option A, inevitable abortion, option B, incomplete abortion, and option C, threatened abortion, and option D, missed abortion, and option E, complete abortion. What is the answer for this one? Yes, I'm waiting for your response in the comment box. So, fatapat do response to the comment, particular question here. Yes, on examination, cervical os is closed here. Okay, and ultrasound showing the live intrauterine fetus. Okay, so there is no any dead fetus inside. Okay, so if in case cervical os is closed, and inside the uterus, instead of the live fetus, if we are getting the dead fetus, okay, intrauterine dead fetus, so that is what we call as in the missed abortion. Okay, so fetus have been dead inside the uterus of the mother, and mother didn't know that because it is having the closed os and there is no any product of conception coming out. Okay, so this is the option D. So actually here the dead fetus will be there. Okay, so I am eliminating the option D, missed abortion. Okay, so because it is not in correct answer, because inside the uterus the fetus is live here. Okay, so then the option A, inevitable abortion. In inevitable abortion, what happens? Internal cervical os is open, and pregnancy will reach to that state where we can't revert back into the normal. Okay, so that is what we call inevitable. Inevitable means non-stoppable. So process of the abortion have been started and we are unable to stop that one. So pregnancy have been reached to that state where the pregnancy is unable to revert back to the normal. So that is what we call as the inevitable abortion. And in the inevitable abortion, why it is we unable to revert back to the normal? Because the cervix is completely open here. Okay, so internal os is open here, right? So in the question what they have given, the cervical os is closed. So option A, inevitable abortion, is not the answer. Okay, so whenever the if examiner wants to ask the question on the incomplete abortion and complete abortion, he will say something that the a product of conception is coming out of the uterus. Yes, if the complete product of the conception came out of the uterus, means product of the conception means, so this is the uterus, okay, and here is the placenta and here is the fetus. Okay, so this placenta and fetus are called as the product of the conception. If this product of the conception completely came out of the uterus, okay, and whenever we will do the ultrasonography, there is empty uterus we are getting. Okay, complete product of conception came out, and on the USG empty uterus we are getting, means that is what we call as the complete abortion. Okay, so that is what we call the complete abortion. Is that anything mentioned in the question? So nothing is mentioned. Nowhere mentioned that is the product of conception came out. Okay, so this is not in complete abortion, and I am eliminating the option E. Okay, so then comes to the second option. So that is the incomplete abortion. Okay, incomplete abortion means the process of abortion will start and half of the product of conception will come out. Okay, so this half of the placenta and half of the fetus will come out of the uterus. Okay, so half will remain inside, right? So half will come out, half will remain inside. So that is what we call as the incomplete abortion. Is that anything mentioned in the question? So nothing mentioned, so I am eliminating the option B also. So particular answer for this question goes to the threatened abortion. Okay, so here in the question they have clearly mentioned that it's in the 28-year-old woman and she is 10-week pregnant and she is having the mild painless vaginal bleeding. Remember beta, the golden word, the golden and again golden word, the only one abortion where we are getting the painless vaginal bleeding is our threatened abortion. Just here the threat will come, so no abortion will be started here, just the abortion threat will come. Okay, but the internal os is closed and the product of conception is still inside the uterus only. Just our aim is to continue the pregnancy, just give the bed rest for the 48 hours. Okay, so not complete bed rest, just a simple bed rest. She can walk, no problem, but she should not do any vigorous activities, any vigorous exercises, and should not be any intercourse if the threatened abortion happens. Okay, so don't do vigorous activity and don't go for the intercourses if the threatened abortion happens. Okay, so this is the very important thing, keep in your mind. Okay, so what are the things we have studied in the threatened abortion? Yes. In the threatened abortion, what happened to the internal os? Internal os is closed. Okay, so what happened to product of conception? Product of conception not coming out. Okay, so not coming out. So when you will do the ultrasonography, what happens here? There is live fetus. Okay, so there is live fetus inside the uterus. If it is dead fetus and os is closed and no product of conception is coming out, that is what you call the missed abortion. Okay, so right here side only. Okay, so in the missed abortion, what happens? In the missed abortion, again internal os is same, closed. Okay, and product of conception same, it will not come out. Okay, so it will not coming out, it will not come out. Only in the complete and incomplete abortion product of conception will come out. Other than that, in nothing, in the no any abortions, the product of conception will come out. Okay, so and whenever we will do the ultrasonography, here we will get the dead fetus. Okay, here we will get the dead fetus, right? So when we will do the per abdominal examination, so that time height of the uterus is equal to the period of the gestation. Why? Because in the threatened abortion the baby is live, so live is means there is normal growth is there. Okay, so height of uterus is equal to period of gestation. Very important thing, keep in our mind. And when in the missed abortion, we will see the baby is dead here, means there is no any growth is there in the baby. Okay, so when we will do the per abdominal examination, so the height of uterus is low. Okay, so very important, and not equal to the period of gestation. So these things you have to keep in your mind. Okay, so this is how the majorly we will difference between the threatened abortion and the missed abortion. Hope it is clear to every one of you. And here is the next question. Yes, the question is very simple and very important coming in front of you all. A 26-year-old woman at 10 weeks of the gestation, she comes for the routine antenatal checkup. So now she comes to the routine antenatal checkup. Okay, and she reports there is a dirty brown discharge or the pain is there in the lower abdomen segment. The pain is there, and in the dirty brown color discharge is coming through the vagina. And we will do the ultrasound. In the ultrasound, there is non-viable fetus, means the dead fetus is there, but non-viable fetus with no cardiac activity. It means no cardiac activity in the fetus means the fetus is dead here. Okay, so the fetus is dead here, and cervix is closed. Beta, I told fetus dead and cervix is closed. Okay, cervix is closed. So what is this particular answer goes to the, just we have discussed here. Yes, so internal os is closed, the cervical os is closed, and fetus is dead. Okay, and product of conception anything is mentioned now, so nothing is coming out, product of conception not coming out. Okay, so this is the classically we can say a case of the missed abortion. Okay, what happens in the missed abortion? So remember, only one abortion where the dirty brown color discharge will come, so that is the missed abortion. Okay, and in the missed abortion, the maximum chance of disseminated intravascular coagulopathy will be there. Sir, why, sir? Why means, so remember, what is missed abortion? In the missed abortion, the fetus inside the mother womb already have dead, and internal os is closed, means the fetus have not came out. So now just she is getting the dirty brown color discharge and the pain, and she came to the hospital. Okay, so fetus have dead and it is remaining inside the mother for the prolonged time. So that means all the inflammatory mediators will release this, and all the abnormal coagulation factors will activate, and all the coagulation factors will consume, and there is no any coagulation factors remaining for the next clot formation. So that is the reason here all the coagulation factors will be abnormally consumed. So we call that one as the consumptive coagulopathy or the disseminated intravascular coagulopathy. Very important, remember. Okay, so in the threatened abortion, there is a live baby is there. There is no any inflammatory markers will be released. In the inevitable abortion, so internal os will be opened and the product of conception will be at the level of the cervical, but it will not come out. So it will be bulged at the vaginal level. Okay, so but it will not come out. Okay, so that is the inevitable abortion, and we can't stop that one. os is already open, so anyhow the process will complete. Okay, so it will convert as a complete abortion, right? In the incomplete abortion, what happens? Half of the product of conception will come out and half of the product of conception will remaining inside the uterus, and in the USG we will get the half of the product of conception. Okay, and when we will do the per abdominal examination also, the height of the uterus is lower as compared to the period of the gestation. Okay, so that one we will see in the incomplete abortion. Okay, so one thing we have to remember, the cervical os is closed and no cardiac activity or the no viable fetus, so that is the a very very important missed abortion is our answer. Okay, so hope it is clear to every one of you. And here is the next question. Okay, so please do read the question completely till the end and give the best answer for this particular question. Yes, I'm waiting for your answer. A 32-year-old woman, 11-week pregnant, presents with a heavy vaginal bleeding and lower abdominal is cramping. So what happened? Now she is having the heavy vaginal bleeding and lower abdomen is started to cramping. On pelvic examination, cervix is dilated. Okay, cervix is dilated and product of conception are seen bulged through the cervical os. Okay, better note it down. Don't confuse. So they have given product of conception seen bulged through the cervical os. Okay, means still the product of conception inside the cervix only. Just in the os of the cervix, we can easily see that product of conception, but it still not came out of the uterus. Okay, so remember, so intentionally I have inserted this question because you people will comes into a confusion that the product of conception is there. Beta, product of conception coming out means, so that is the incomplete or complete abortion. If it is available still inside the internal os means that is not an incomplete abortion, that is not an complete abortion. Remember. Okay, so what is the most likely diagnosis? Sir, what happened here? So heavy vaginal bleeding is there, lower abdomen cramping is there, means pain is there, bleeding is there, and cervix is dilated. So I told cervix dilated and product of conception is bulged and clearly visible at internal os. Okay, at internal os. So product of conception is clearly visible at the internal os and cervix is dilated. So anyhow we are unable to stop this process of the abortion. Okay, so it is unstoppable. Okay, it is what we call, this one is in the unstoppable, or we can say this one is in the inevitable. Okay, so we can say this one is in the inevitable abortion. Very very important, keep in your mind. Okay, in the threatened abortion, the cervical os is closed. Okay, it's not opened. In the question they have given cervical os is dilated, so it is not correct answer. Cervical os is closed means that is the threatened abortion. Here the cervical os is opened, so that is not threatened abortion. Okay, in the missed abortion, again the cervical os is closed. Okay, cervical os is closed in the missed abortion. Okay, and in the inevitable abortion, again the cervical os is open. Okay, so in the cervical os is open, so that is the reason, so we can't stop a process of the abortion. Okay, so where the definition itself says in the inevitable abortion, this is the type of the abortion which reaches to such a state where the reversing of the that particular pregnancy back to the normal is not possible. Okay, so that is what we call the unstoppable or inevitable abortion. Okay, so in the complete abortion, all the product of conception will come out, and after that again the cervical internal os becomes closed here. Okay, initially open, all the product of conception comes out, then the cervical os becomes closed. Okay, so this is the complete abortion. Only in the inevitable abortion, only in the incomplete abortion, the cervical os is open. Okay, other than in the complete abortion, missed abortion, threatened abortion, cervical os is closed. Okay, so yes sir, the incomplete abortion, how the product of conception will come out, sir? At the time of the coming out of product of conception completely out of the uterus, that time it will open. Whenever the process completes, that time automatically cervix will get closes. Okay, so that is the very very important thing, keep in your mind. Okay, so hope it is clear to every one of you, and the answer for this question goes to the only one and best answer, that is the inevitable abortion, because in the option they have given the cervix is dilated and product of conception have came to the internal os Okay, so and the lower abdominal pain and vaginal bleeding is there. So the answer for this question goes to the very important inevitable abortion. Okay, so let's go to the next very important question and concept here. Yes, fatapat do response to your answer now. Okay, so almost all the abortions we have discussed and all the criteria also multiple time I have revised in front of you all. Okay, so I want your answer in the comment box. So fatapat do response to the particular question. Yes, all the type of abortion we will finish very quickly, then we will go for the next golden points, right? The question is very simple. A 30-year-old woman presents with a history of 9 weeks of the amenorrhea. Okay, so she is having the history of the 9 weeks of the amenorrhea. Means amenorrhea is there, means so that it may be due to the pregnancy. Okay, so you know in the pregnancy there is no menstrual cycle. Okay, so she is having the 9-week history of the amenorrhea, followed by the heavy vaginal bleeding. Okay, so now she is getting the heavy vaginal bleeding and passage of the some tissue. Okay, yes, note the point. Passage of the some tissue means product of conception have started to come out. On examination, her color is completely pale. So why she is pale? Why? Because there is a heavy vaginal bleeding is there. Okay, so there is no any oxygenation carrying cells are there. Okay, so because of the heavy bleeding, the more RBC are went out and no RBC means the body become pale here. Okay, and her cervix is opened. Her cervix is opened and ultrasound shows a retained product of the conception in the uterus. Very important. Keep in your mind. So this is a case of the yes. Many of you have given the correct answer. That is the incomplete abortion, right? So remember the difference between the incomplete abortion and complete abortion. So this is very important for you. Okay, so to differentiate in the main exam also. Okay, so right, so remember in the incomplete abortion cervical os is opened. In the complete abortion cervical os initially open, but when we will examine, so till that it is closed. Okay, so remember in the incomplete abortion cervical os is open, in the complete abortion cervical os is closed, and product of conception half comes out and remaining retained inside. Okay, so remaining retained in uterus. Okay, here in the complete abortion, so we call this one as in the complete. Why? Because the product of conception completely comes out. Okay, so it completely comes out. Okay, so whenever we will do the ultrasonography, okay, so that time in the uterus, so half means this particular retained part will be visible. Okay, so retained clots we can say, or product of conception we can say visible. But in the complete abortion, when we will do the ultrasonography, so uterus become empty. Why? Because completely the product of conception have been came out. Now the uterus become empty. So this is the very important thing what we have to keep in your mind. And in the incomplete abortion, so half came out and half is retained inside, and the os is opened means heavy vaginal bleeding will be there and the highest chance of the shock. Okay, so highest chance of shock is there in the incomplete abortion as compared to the complete abortion. Okay, when you will compare between the incomplete and complete abortion, which abortion is having the highest chance of the shock? So that is the incomplete abortion which have the highest risk of the shock. Okay, so remember in the incomplete abortion I told heavy vaginal bleeding will be there, so that is the reason her color become the pale and passes is some tissue is passing out of the vagina. Okay, and her cervix is open. Okay, I told in the incomplete abortion cervix is open, in the complete abortion cervical os is closed. Okay, in the missed abortion again cervical os is closed. Okay, the threatened abortion, again the cervical os is closed. Okay, so this one thing is enough to identify the answer for you all. Okay, so in the only two abortion, one is incomplete abortion and another one is the inevitable abortion. Okay, so internal os, okay, open in two conditions. So that is the inevitable and incomplete abortion. Okay, so remember, internal os is opened in the inevitable and incomplete. Okay, so in this particular two only abortion, the internal os is opened. Okay, other than this, in the complete also, initially it will open, all the product of conception comes out and then it will become closed. Okay, so this is the concept you have to remember, right? So the now correct answer for this question goes to the option C, and many of you have chosen the correct answer. Hope it is clear to every one of you, and difference between the incomplete and complete abortion is clear. Okay, so here is the next question and the last question on the type of the abortion. Fatapat do response to the question. Yes, I'm waiting for your golden answer in the comment box, because this particular scenario just now only I have explained to every one of you. Yes, a 27-year-old woman with a history of 8 weeks of the amenorrhea. Okay, so she is having the history of amenorrhea. Okay, so remember, beta, in all the type of the pregnancy, there will be a history of the amenorrhea will be there. Okay, sorry. So all type of the abortion, there will be history of the amenorrhea will be there. Why? Because abortion happens after pregnancy only. If there is no pregnancy, how the abortion will happen? So this is a simple logic, right? So every woman, she will tell a history of the amenorrhea. After that, there is a sudden vaginal bleeding. Okay, so that is the thing, main thing we have to keep in our mind. Okay, so she is having the history of the 8 week of the amenorrhea, and after that, she is recently vaginal bleeding. Okay, and passage of the tissue is there, and she now has no pain or bleeding. Okay, so bleeding also stopped, pain also stopped. Okay, on examination, her cervix is closed and ultrasound shows the empty uterus. Okay, so this is the classical thing. Just now only I have explained in the complete type of the abortion. Okay, cervix is closed and no bleeding and no pain, means all the product of conception came out. Okay, so while coming out product of conception, that time pain and bleeding will happen after that. Okay, so in the question she have clearly mentioned that, okay, she is having amenorrhea. After that, recently vaginal bleeding with the passage of the tissue is there. Okay, so passage of the tissue is there, and now uterus is empty, means all the tissue, means all the product of conception came out of the uterus. Okay, so nothing retained inside. So that is what we call as in the complete abortion. Okay, so this goes to the correct answer, and hope every one of you have enjoyed the particular type of the abortion. Okay, so hope it is clear to every one of you, right? So here is the next very important cause. Okay, so next very important question. So remember, this is very important one. Okay, so what is the most common cause of the spontaneous isolated abortion in the first trimester? Option A, maternal infection. Option B, Apla syndrome. And option C, that is the chromosomal abnormality. And option D is the cervical incompetence. So what is your answer? What is the most common cause of the spontaneous isolated abortion in the first trimester? Beta, what is isolated abortion? Remember, in the abortion, if there is only one episode is there, okay, so only one episode is there, so we call this one as in the single episode or isolated abortion. Okay, so if abortion 3 or more than or equal to 3 pregnancy loss, okay, before period of viability, so we call this one as in the recurrent pregnancy loss, or we can say this one is in the recurrent abortion. Okay, so now the question is asking related to the isolated abortion, means so there is recently one episode of the abortion is there. Okay, so remember. Okay, so now comes to the question. Okay, so isolated abortion and in the first trimester, what is the most common cause? Okay, so the cause they are asking. So whenever we will talk about the cause of the abortion, okay, in the single or the isolated abortion in the first trimester and in the second trimester, In the both first and second trimester, the most common cause is only one thing. Most common cause is only one thing, that is the chromosomal abnormality. Chromosomal abnormality, or we can say this one as in the aneuploidy. Okay, so we call this one as the abnormal number of the chromosomes or the aneuploidy. Okay, so whenever we will talk about the recurrent abortion or the recurrent pregnancy loss, okay, it means the 3 or more than 3 pregnancy loss have been happened continuously. So that is what you call the recurrent abortion. In this one, okay, so most common cause in the first trimester, okay, that is the most common cause in first trimester is idiopathic, means don't know. Okay, so that is idiopathic. Okay, so this is the very important thing. And that is second one, most common cause in second trimester. This is your exam or hot topic, so that is the answer goes to the cervical incompetence. So what is the cervical incompetence and how to manage that one? Everything I will explain. So just remember the very important word, that is the cervical incompetence here. So this is the multiple time asked question. Okay, so the most common cause of the abortion in the second trimester. Okay, so most common cause of the recurrent abortion in the second trimester of the pregnancy is the cervical incompetence, cervical incompetence, cervical incompetence. Okay, so recurrent abortion in the first trimester, the most common cause is idiopathic. And in the abortion, so there is a single episode or the isolated abortion, the first and second trimester, the most common cause is the chromosomal abnormality. So this is the very important thing, just keep in your mind, and this particular chart is very important for you all. Okay, so what is the most common cause of the spontaneous isolated abortion? Spontaneous isolated abortion in the first trimester. Okay, so I told in the isolated abortion, the first trimester or the second trimester, the most common cause is the our cervical chromosomal abnormality, or we can say the aneuploidy also. This goes to the correct answer, right? So this cervical incompetence is the most common cause of recurrent pregnancy loss or the recurrent abortion in second trimester. In the second trimester, very important thing, keep in your mind beta. So these questions have been multiple time asked in your exam. Okay, and the maternal infection, especially torch. Okay, so we have discussed everything related to the torch, and torch will never ever causes the recurrent pregnancy loss. Torch will only it will causes the isolated abortion. Okay, or the only it is having the ability to cause a single episode of the abortion. Okay, it is not having the ability to cause the repeated time of the abortion. Okay, so very important. In the torch, only isolated abortion happens due to the torch. So due to the torch, there is no any recurrent loss of the pregnancy. Only one infection is there which will cause the recurrent loss of the pregnancy. Can anyone wants to answer? Yes, which only one infection which is having the ability to cause the recurrent loss of the pregnancy? Yes, only one infection which causes recurrent loss of pregnancy. Yes, which is that particular infection? Yes, very nice of you all. So that is the syphilis. Okay, so syphilis is the only one infection so which is having the ability to cause the recurrent loss of the pregnancy. Okay, so here it happens due to the trypanosoma or the trypanosoma pallidum infection. So this is having the only one infection which will causes the recurrent loss of the pregnancy in the torch. Okay, toxoplasmosis, rubella, okay, cytomegalovirus virus and the herpes simplex virus. So these are having the ability to only cause the one-time abortion, that is the isolated abortion, what we can say here. Okay, so the very important thing I have explained to you all here, Okay, so you have to keep in your mind regarding this one because it is very important for you all, right? So the next question is here, and you have to remember this particular golden point also. So hypothyroidism will only it is having the ability to cause the recurrent abortion. Okay, so it may cause the abortion 3 times or more than 3 times. Okay, more than or equal to 3 times it will causes the abortion. So that is the hypothyroidism. He is having the ability to cause the recurrent abortion. But in the hyperthyroidism, it is not like that. Only single episode of the abortion will happen due to the hyperthyroidism. Okay, and torch infection will causes the only single episode of the abortion. So that is the isolated abortion will happens. So okay, no like there is no any recurrent abortion in the torch infection, and there is no any recurrent abortion due to the hyperthyroidism. Okay, so in the hypothyroidism there is risk of the recurrent abortion is there. Okay, so very important, recurrent abortion in the second trimester we have to consider means first one is the cervical incompetence. Okay, second one is the Apler syndrome. Apler syndrome, that is the antiphospholipid antibody syndrome. Okay, so along with that there will be a hypothyroidism and congenital syphilis. Okay, what we can say, the congenital syphilis infection. So these infections only is having the ability to cause the recurrent abortions. Okay, so other than this everything will be a single episode of the abortion. Okay, so keep in your mind, right? So hope it is clear to every one of you. And here is the next question which is there in front of you all. So please do read the question completely and try to give the best answer. Okay, so I'm waiting for your answer in the comment box. Padafat. What is the most appropriate management for pregnant woman to diagnosed with cervical incompetence and history of the second trimester pregnancy losses? Okay, so option A is the emergency cesarean section, option B is the progesterone only therapy, and option C is the elective cervical cerclage surgery, and option D is the induction of the labor. So what is the correct answer? So this is your important question. Okay, remember, so the question, the most appropriate management for the pregnant woman. Okay, so she is diagnosed with the cervical incompetence. Okay, and she is having the history of the second trimester pregnancy, loss of the pregnancy means second trimester abortion is happening, and the most common cause of the second trimester abortion is, yes, the most common cause for the second trimester abortion is the cervical incompetence. Okay, so already we have discussed it. Sir, what is the cervical incompetence? So look at this particular image better. So this is our uterus. Okay, and this is our cervix here. So this is the internal os. So this internal os should and must completely closed one. Okay, so it should and must closed one. If this particular internal os is suddenly opening and the membrane is rupturing, and the fetus inside the membrane which is coming out. So this is what we call as the incompetent cervix. Okay, cervix is not having power to hold the baby inside. Okay, so it is not competent to hold the baby inside. So that is what we call the incompetent cervix. Okay, cervical incompetence means cervix will suddenly open and the rupture of the membrane will happen and the fetus will comes out of the cervix. So this is what we call as the cervical incompetence. So this is the most common cause for the recurrent loss of the pregnancy or the recurrent abortion in the second trimester, multiple time, repeated. I am telling the word because it is the important for you all. Okay, so hope it is clear to everyone. Yes, it's clear, sir. Sir, what is the management we have to do, sir? Sir, what happened here? I told now cervix is suddenly opening in the second trimester. I told, sir, in the second trimester, in between the 14 to 18 week. In between the 14 to 18 week, so take one suture and apply the suture to this particular cervix and make it tight. Okay, so make it tight. So this is what we call as the elective cervical cerclage surgery. Okay, so this elective cervical cerclage surgery will be done in case of the second trimester recurrent loss of the pregnancy, in case of the cervical incompetence, and in the recurrent preterm labor also happening means, so in that particular situation also we will do the Shirodkar and McDonald type of the elective cerclage surgery. Okay, in the elective cerclage surgery we have again the 3 types. Okay, so one is the transabdominal cerclage surgery, another one is the Shirodkar cerclage surgery, and third one is the our McDonald cerclage surgery. Okay, so three types we have here. Okay, so what is the difference in between three, sir? Better the first one, here we will take incision over the abdomen. Okay, so that is the reason we call this one as in the transabdominal cerclage surgery. Okay, so this is the particular suture we will apply by taking the incision over the abdomen, and we will apply the suture to the lower portion of the cervix, and we will make it tight, and baby will not come out. So this is how we have to prevent the incompetent cervix. Okay, so one method, that is the transabdominal cerclage surgery. Okay, the second method is the Shirodkar cerclage surgery. Okay, so Shirodkar cerclage surgery, what happening? Okay, so what happening in the Shirodkar cerclage surgery? Look at this one. So we have approached through the transvaginal. Okay, so here I told we have taken the incision through the abdomen, and this Shirodkar surgery, same we will apply the suture to the lower portion of the cervix by entering through the vagina. Okay, so this is the transvaginal approach. We will apply the suture to the lower portion of the cervix. Okay, so this is the Shirodkar surgery. And the McDonald cerclage surgery, in the McDonald cerclage surgery, what we will do, similarly we will apply the suture to the lower portion of the uterus. Okay, so that is lower portion of the cervix, that is in a style of the pursed lip suture. Okay, so how it is the, it is the, we will apply pursed lip suture. Okay, so what it means, sir? I mean here, consider, so this is the cervix you consider. Okay, so in this particular cervix, if I am applying the suture, okay, so 1 second, consider this is a suture material. Okay, so just I am trying to make a suture like this. Okay, so this is what we call as in the Shirodkar cerclage surgery. Okay, in a McDonald surgery, what I will do, so I will take this particular suture, and I will insert inside the cervix, and I will come out, then again I will insert, then again I will come out. So this is how our suture material looks like. Okay, so one is above and another next part is below, above then below. Okay, so this is how, if I am making the string of the what we can say, the purse, you know, the in the old ladies, they are having the purse. Okay, so it is having the string. Okay, so they used to pull it and they used to lock their pulse. Okay, so that kind of the suturing we are doing here. Okay, we can look at the image also. This particular suture is above, and we went inside, and again we came out, and again we went inside, again we came out. Okay, so this particular technique we call as in the McDonald cerclage surgery. Here we are doing the pursed lip suturing technique. Okay, so very important, keep in your mind three types of the cerclage surgery. One is transabdominal, we are taking the abdominal incision and we are applying the suture to the lower portion of the uterus. And second one is the Shirodkar surgery, transvaginal approach we went. Okay, and we have just applied the suture and we have made the tight of the cervix. And another McDonald type, so just we have done the suturing in the pursed lip technique. Okay, this is the three types of the cerclage surgery. We will do this particular cerclage surgery in case of the recurrent abortion in the second trimester, and most importantly we will do this one to prevent the preterm labor also. Okay, in such and in few conditions. And so remember, what is the timing when we have to do golden point chanting, when we have to do the cerclage surgery. So cerclage surgery will be done between the 14 to 18 week. Okay, so when we have to remove this one, we have to remove this one before labor pain start. Okay, so or we can say we have to remove this one at 37 week. Okay, or whenever the labor pain starts. Okay, we can say whenever labor pain starts. Okay, so this is the very important thing, keep in your mind. Okay, so this will be helpful for your exam. Okay, so when to remove at 37 week we have to remove. When to apply suture, okay, at the 14 to 18 week of the period of the gestation. Okay, it is important for you all, right? So I hope it is clear to everyone of you all. And here is the some important image based question is there in front of you all, so please do look at this image here. Okay, so the name is also mentioned. So this is what we call as in the manual vacuum aspiration. Okay, so this is the manual vacuum aspiration syringe. We will do this one in a case of the medical termination of the pregnancy in the first trimester, MTP in first trimester. we will do the manual vacuum aspiration. So this is the image of the manual vacuum aspiration. I will discuss in detail related to the manual vacuum aspiration. Okay, so in the MTP, so just now try to understand the concept here. Okay, so the second one image what I'm showing here is the, so this is our Karman cannula, very very important image based question again. So this is the our Karman cannula. So how to identify Karman cannula, sir? At the tip of the Karman cannula, okay, so here there are the two triangular opening is there. Okay, two triangular opening is there at the tip of the Karman cannula. Sir, how to choose the size of the Karman cannula, sir? So while doing the period of like medical termination of the pregnancy, or we have to suctioning the retained part of the abortion. Okay, so Karman cannula will be used in the suctioning of the both in the retained portion in the incomplete abortion. Okay, to make it complete, so we have to do the suctioning. Okay, so there I will use the Karman cannula, and again in the medical termination of the pregnancy also I will use the Karman cannula to suction out the all the product of conception. Okay, so Karman cannula will be used in these two very important situations, remember. Okay, so already asked the question multiple time, right? So very very important. So this cannula is having the two triangular shape opening at the tip. Okay, and so this complete tip is completely blunt here. Okay, so in order to prevent the rupture of the rupture of the uterus, the tip of the Karman cannula is blunt here. Okay, so important, remember how to choose the size of the Karman cannula, sir. Sir, you have to make a very simple formula, that is the period of gestation minus 1. Okay, so few book says that Karman cannula should be a size of the equal to the period of gestation. Okay, and few books says that the period of gestation minus 1. So your answer, and for the Norcet you have to consider this one only. Okay, in the recent exam, in the medical exam, it was asked like this, and the like many like good books and the good teachers, they have said the formula, that is the period of gestation minus 1 is the final formula to be considered for this choosing the Karman cannula size. Okay, so consider, sir, we are doing the medical termination of the pregnancy at the 9 week. Okay, so 9 week, so which Karman cannula size did you use? Sir, I will make the 9 week minus 1, sir. 8 week or the 8 French Karman cannula I will use, sir. So this is the very very important thing, just you have to keep in your mind. Okay, so not 8 week, there is the 8 French. Okay, so Karman cannula size number 8 we will use. Okay, so hope it is clear to every one of you. And the next image what I am showing here is the Hagar's dilator. Okay, so before insertion of the Karman cannula inside the cervix and before reaching the uterus, we have to dilate the cervix completely. Okay, so how we have to dilate the cervix completely, sir? First we will use the this size cannula, Hagar dilator, and we will insert inside the cervix. Then we will use this one, then this one. Okay, when the cervix is sufficiently dilated, so just after that we will insert this Karman cannula. Okay, so this Karman cannula we will attach here to this particular suction syringe. Okay, and we will insert inside and we will suck that the product of conception. Okay, this is how the medical termination of the pregnancy will be done by using the manual vacuum aspiration. Okay, so hope it is clear. And this is the Hagar dilator. It is your very very important image based question, beta. So already asked question in your Norcet. Okay, Hagar dilator asked question, Karman cannula already asked question, and manual vacuum aspiration. So for this question, last time they have asked the how much pressure this particular syringe creates. Okay, so that is our 660 mm of Hg is our correct answer. Okay, so this was the very very important thing we have to keep in your mind. Okay, so one more word it will come, that is the vacuum aspiration. Okay, so that is the different thing, I will explain that one also. In that one we will apply the in the suction and evacuation. Okay, so in the suction and evacuation you have to apply the pressure of the 600 mm of Hg. Okay, so here in the manual vacuum aspiration, the applied pressure should be 660 mm of Hg. Don't confuse suction and evacuation. We have to do again with the Karman cannula. We will apply the tip of the Karman cannula to the suction apparatus. Okay, so there we will apply the pressure of the 660 mm of 600 mm of Hg in the suction and evacuation, and in the manual vacuum aspiration it's a 660 mm of Hg. So this is your golden points and very important point, just you have to keep in your mind. Okay, so hope it is clear to every one of you. And yes, so remember this portion also, like cervical cerclage surgery I had told. Okay, in the cervical cerclage surgery, so these are the contraindications where we will not do the cervical cerclage surgery. Okay, if the membrane have been already ruptured, okay, so there is no any use of suturing the cervix. Okay, membrane have been already ruptured means the anyhow the fetus will comes out. Anyhow the if we are doing the suturing means the fetus will die inside only. Okay, so in order to prevent that one, membrane is already ruptured means don't do the cerclage surgery. Okay, so if the cervix is dilated more than 4 centimeter, okay, so don't do the cerclage surgery. Sorry. Okay, if the cervix is already dilated more than 4 centimeter, so cerclage surgery should be contraindicated. And if the patient is having the infection like chorioamnitis, okay, so fetal membrane infection is there, okay, chorion, amnion, you know, so the under amnion means internal fetal membrane is the amnion, okay, bahar chorion, okay, so that the outer fetal membrane is called as the chorion. Yes, the internal fetal membrane we call as the amnion, and external fetal membrane we call as the chorion. If the amniotic and the chorionic membrane is get infected, so there is a chorioamnitis happen, means in that situation also the cervical cerclage surgery is contraindicated. And the congenital anomaly, if the fetus is having the anencephaly, encephalocele, so the patient the patient or the fetus will land into a abortion only anyhow. So we can terminate that pregnancy anyhow, because the anencephaly baby and encephalocele baby, there is 0% chance to live after the birth. Okay, so that is the reason in that particular situation, cerclage surgery there is no use. Okay, so keep this very important point in your mind. And to diagnose the incompetent cervix by USG, okay, so ultrasonography, diagnostic criteria of incompetent cervix by ultrasonography. Remember, if the cervix length of cervix have been less than 2 centimeter and dilation of cervix have been more than 2.5 centimeter, so this particular situation we call this one as in the incompetent cervix. Okay, sorry, so make a small correction here. So length of the cervix is less than 2.5 centimeter. Okay, yes, the length of the cervix is less than 2.5 centimeter. So, and the dilation of the cervix less than 2.5 centimeters the length of the cervix, and the dilation of the cervix is more than 2 centimeter. So this one we call as in the incompetent cervix. Okay, so remember, okay, so this is the very important thing, right? So this particular thing, if you are getting in the ultrasonography, so that is what we call that particular cervix as an incompetent cervix. Okay, so very important, just you have to keep in your mind, right? So the next question is here in front of you all, like this. Yes. The question is very simple. How many weeks of gestation can a pregnancy be terminated with the opinion of the one registered medical practitioner? Yes, the very simple question and very important question for every one of you. How many weeks of the gestation can be pregnancy terminated with the opinion of the one medical registered opinion of the one registered medical practitioner? Very important question. Okay, so this is according to the a new medical termination of the pregnancy act 2021. Okay, so remember better the old concept. If pregnancy is less than 12 weeks, one doctor opinion required. I am telling the old concept, so don't remember this one, just I will vanish out, just to for the comparison purpose I am telling. Okay, so old concept, so this is according to the 1972 MTP Act. Okay, so this is according to the 1972 MTP Act. If the pregnancy is less than 12 week, one doctor permission is required. If the pregnancy is between the 12 week to the 20 week, okay, so two doctor opinion is required. Okay, more than 20 week MTP not allowed. So this is according to the old MTP Act. Okay, so just vanish it now. Okay, so fix the new important rules of the MTP Act, medical termination of the pregnancy Act 2021. Okay, so according to this one, okay, keep in your mind, up to 20 week, one doctor opinion is required. Okay, up to 20 weeks, one doctor opinion is required, and 20 to 24 week, two doctor opinion is required. Okay, so remember, so in the old MTP Act, after 20 week, there is MTP was not allowed. Okay, so in the new MTP Act, so till the 24 week, we can do the MTP. Okay, so according to the new act, so we can do the MTP, we can do medical termination of the pregnancy according to the new rule. Okay, so very important, but in selected cases only. Okay, in the selected cases only, not for the regular cases. Remember, very important points, sir. Is this clear to every one of you? So the comes to the question, then we will go for the next question. There we will get the more clarity. Okay, so here is the next question. So how many weeks of the gestation can be pregnancy to be terminated with the opinion of the one registered medical practitioner? So I told opinion of the one medical registered practitioner. So we can do a MTP up to 20 weeks. Okay, for up to 24 weeks, we require the two registered medical practitioner. Okay, so this is according to the new rule. Keep in your mind. Okay, so here one doctor opinion is required, and here a two doctor opinion is required. Okay, hope it is clear to every one of you. And in the new rule, up to 24 week of gestation, the MTP is allowed in the selected cases. Okay, so remember. So comes to the next very important question. According to the medical termination of the pregnancy amendment act act in the year of the 2021, which of the following categories of the woman are eligible to seek a medical termination of the pregnancy up to 24 weeks? Okay, so up to 24 weeks, MTP will be done in what all are the eligible women. Okay, I told we will do the medical termination of the pregnancy up to 24 weeks according to the new amendment of the MTP. Okay, so but in the selected cases. So what are the selected cases, sir? If the woman, she underwent for the sexual assault, like a rape or the incest. Okay, so rape means, yeah, every one of you know this is the general term, and incest means if the woman, she get pregnant by the one's own family members, like a girl is like get pregnant by his own brother or his own father. So in such kind of the cases, we call it incest. Okay, so incest. And the rape victim, up to 24 week, we will do up to 24 week, we will do the medical termination of the pregnancy. Okay, so we will do medical termination of the pregnancy up to 24 week period of the gestation. Okay, so in case of the contraceptive failure, beta, still the maximum we can do up to 20 week only. Okay, so up to 20 week, if the contraceptive failure happened and after 20 week a female comes to the medical termination of pregnancy, means that is not possible. Okay, so up to 20 week only allowed if the contraceptive failure happens. Okay, so in the congenital anomalies, okay, in the congenital anomalies, again up to 24 weeks it is allowed. Okay, so in cases of substantial anomalies, in case of substantial anomaly like anencephaly, encephalocele, okay, so in such cases, no limit is there. Okay, no limit, but permission required from the competent medical board. Okay, so very important, keep in your mind. Okay, in the substantial anomaly, there is no any risk, like limit is there to do the medical termination of the pregnancy. So there is no limit, we can do till last day of the pregnancy. Okay, so but permission is required from the medical like competent medical board. Okay, so in the congenital anomalies and in the like in the victim of the rape and sexual assault and incest, so in that particular cases we have to do up to 24 week, and in the congenital anomaly 24 week. Okay, so here answer goes to the option D, goes to the correct answer. Okay, because in the contraceptive failure till 20 week only the medical termination of the pregnancy is allowed. Okay, so this is the very important, and here only one doctor permission or the one medical registered medical pregnancy, like one RMP, that is the one registered medical practitioner permission is required. But in the congenital anomaly and in the rape victim, we are doing till 24 weeks. So here the two registered medical practitioner permission is required. Okay, so very important, just we have to keep in our mind. Okay, hope it is clear to every one of you, and answer goes to the option D. So yes, many of you have given the correct answer. Yes, so that is the right one. Okay, so here is the next question is there waiting for you all. Yes, I want your correct answer in the comment box. Fatapat do mention your correct answer, beta. Which of the following is the most commonly used method for termination of the pregnancy up to 9 weeks of the gestation? Up to 9 weeks of the gestation. So which one is the most commonly used method of termination of the pregnancy up to the 9 weeks of the gestation? Option A, suction and evacuation. Suction and evacuation will be done in the second trimester. So 9 weeks means it is first trimester. I am eliminating the option A. So then comes to the manual vacuum aspiration. Okay, and option B. So that is the manual vacuum aspiration. Then in the option C, mifepristone followed by the misoprostol, and option D, yes, that is the all the above goes to the correct answer. What is the correct answer here? Okay, so what are the techniques we have to go for the most commonly used method for the termination of the pregnancy up to 9 weeks? So that is the manual vacuum aspiration. So manual vacuum aspiration in India, it is allowed up to 7 weeks, but WHO says up to 9 weeks we can do the manual vacuum aspiration. Okay, so this is in India. So this is according to the World Health Organization, WHO. So which one we have to follow for Norcet? This one we have to follow for the Norcet. Okay, so most commonly used one is that's our manual vacuum aspiration. Okay, so hope it is clear. So the next question is here. Which type of the suction catheter is most commonly used for the manual vacuum aspiration in the MTP? So already we have discussed this one, image based question. So there is the Karman cannula will be used as a most commonly used type of the cannula in the manual vacuum aspiration in the medical termination of the pregnancy. So image also have shown. So this particular Karman cannula. Okay, so we will attach to this particular manual vacuum aspiration syringe, and we will insert inside the cervix after dilating the cervix with the help of the Hagar dilator. Okay, so we will insert this particular Karman cannula inside the uterus, and we will suck out all the product of conception. So that is the very important thing, just we have to keep in our mind. Okay, so the next question is there in front of you all like this. Yes, what is the recommended suction pressure for manual vacuum aspiration during the first trimester of the pregnancy? Yes, what is the recommended suction pressure in mm of Hg for manual vacuum aspiration? Okay, during the first trimester of the pregnancy. So we are doing the manual vacuum aspiration. Okay, so with the help of the manual vacuum aspiration syringe. So what is the recommended pressure I have told? So that is the 660 mm of Hg is the single best answer. Okay, and for the suction and evacuation, so the pressure should be used is the 600 mm of Hg. Remember, so these both are different situation. In the suction and evacuation, 600 mm of Hg. In manual vacuum aspiration with the help of the syringe, 660 mm of Hg. Okay, search the answer here. 50 to 100, wrong one. 100 to 150, wrong one. 700 to 900, more. Okay, so 660 mm of Hg. So option C goes to the correct answer. So in average, we can say there is the 400 to in range. It is in the 400 to 660, the single best answer. And one time in the Norcet, they have asked the question of the 660 mm of Hg. So this is the very important thing. Just you have to keep in your mind. Okay. So here are the best methods of doing the medical termination of the pregnancy. So that is option these are the very important and golden points you have to remember. Okay, if the less than 7 week, okay, so medical abortion, so that is the best method. And if the 7 to 12 weeks, so that is the suction and evacuation is the best method. And if it is more than 12 weeks, that is the Misoprostol 400 microgram 4 hourly, and maximum dose of the 5 dose we can give. Okay, so this is the very important thing, just we have to keep in our mind. Okay, so these are the golden points and the very important questions what we have discussed, and take a screenshot of this one, and at least 2 or 3 times you have to just revise in your exam, so it will be helpful for you all. Okay, so if you have any doubts, so do mention in the comment box. I will respond to your doubts immediately. Okay, so and hope you people have enjoyed the class and session completely, and the whatever the content I have given in the short period, and you people have been enjoyed this particular content. Okay, so hope it is clear to everyone, and here is the assignment to every one of you. Okay, so don't forget this assignment to mention in the comment box. Okay, suction pressure of manual vacuum aspiration. Okay, so manual vacuum aspiration, how much, and suction pressure of suction and evacuation. Okay, so very important. And the second one, the third question is this one. Okay, so which one is the best if the less than 7 week of the gestation? Okay, so best method of termination of pregnancy, or we can say best method of the medical termination of the pregnancy, in less than 7 week. So just do mention your answer in the comment box. Okay, so hope this particular session you people have enjoyed. Okay, so remember, in the less than 7 week, how we will do the medical termination of the pregnancy? Can anyone know? This particular drug criteria is very important, so just I will tell, just give me a second. Yes, we will give the 2 drugs here. One is whenever the female comes to the OPD, this one will be done in the OPD basis only. Okay, in the less than 7 week. Okay, medical termination of pregnancy, medical method. Okay, so by using the medical method, so that is the medicines. Okay, first drugs we will give here is the mifepristone. Just give me a second. Just I will see the dose. Sometimes I will also forget. Yes. So how we have to do the medical termination of the pregnancy in the first trimester if the less than 7 week of the pregnancy means, so by using the tablet what we call as the mifepristone. Okay, so this is mifepristone, so that is of the 200 milligram. Okay, so this is 200 milligram. We will give this one day 1. Okay, so this will be given on the day 1. Okay, so with after 48 hours gap. Okay, after 48 hours gap, again I will give the misoprost. Okay, so I will give the misoprost. This will be given per oral or per vaginal. Okay, so this is 400 microgram. Okay, so this will be the very important, and here the WHO will says, so you have to give the per vaginal only, so that is 800 microgram. Okay, according to the WHO, if asking means only per vaginal, not per oral, only per vaginal, that is the 800 microgram we have to give. Okay, so this is day 1 and this is the day 3. Okay, so day 3 only abortion will happens. Okay, so day 3 abortion will happens. So this is very important, just keep in your mind. So this particular drug regimen is important for you all, and I have told all the important golden points, and don't forget to mention your assignment answers in the question. Okay, so suction pressure of the manual vacuum aspiration is how much, suction pressure of the suction and evacuation is how much, and the best method of doing the MTP in less than 7 week Okay, so which one is the best method, and everything we have covered in the today's session related to the abortion and the medical termination of the pregnancy, old rule and the new rule. Okay, so if any points are missing, just I will try to cover in the next session. So thank you for watching the video till the end, and if you found the content is quality, and if you found content is helpful, so please do subscribe to the channel and hit the like button. And we have the best test series plan for our Norcet 9. Okay, so remember, Norcet 9.0 Super 60 test series. Super 60 test. In the Super 60 test, you will get the same exam like pattern. Okay, same exam like experience, where you will get a 20 multiple choice questions for 18 minutes. Okay, so total 5 sections as like your prelims exam. Okay, and you will get the mains exam also free in that one. Okay, mains exam papers also, live mains exam papers also, it will get free in your particular this Norcet 9 Super 60 test series. And if you want a full batch of the theory, so we have the master batch 1.0, and if you want just important video classes plus a test series, we have the Navagraha plan for the Norcet 9.0. So you can go for that one. Anyone, if you want, you can go for that one. Okay, so thank you for watching the video. Take care of yourself, maintain the good health and healthy environment around you, so that will definitely help you to improve yourself. Okay, so thank you so much for watching the video till the end, and we will meet in the next session. Tab tak ke liye, Jai Hind, Jai Bharat, take care.